Hey everyone, welcome to Communication Part 2. Today we're going to be talking about verbal and non-verbal forms of communication in the massage therapy office. When I reference your textbook, it is going to be the Mosby's Fundamentals of Therapeutic Massage, the 8th edition. So, as we discussed in the touch lecture, communication is the act of exchanging thoughts, feelings, and behavior. And very often, ethical and professional dilemmas result from these communication difficulties, not being able to express ourselves correctly. In addition to touch, our second strongest message is delivered through the kinesthetic mode or body language. All right, as we express ourselves through our bodies, others visually receive the messages and or feel our touch. All right, the tone of voice is also more important than the words spoken. Tone is kinesthetic and auditory because of the pressure waves. They are physically receiving your vibration. We both hear and feel the sound waves from the tone of voice. Words are the least effective part of the communication pattern because if they do not match the tone of voice or the body language, we very often don't trust the words. Also, words have different meanings to different people. So we brought up mirror neurons and stuff before. We're going to talk about mimicking. So, to encourage effective communication, you should begin by identifying your client's communication pattern. The words that they use, the tone of voice, their body language. Find out where they're coming from. Find out what their energy level is. Use neutral topics like the weather or a community event, even if small talk kills you, to adjust your communication pattern to meet that person's communication style. You're going to shift your body language. Like if they're leaning forward, you should lean forward a little bit. Their word choice, all right, if they're very soft spoken, try to become more soft spoken so that if you have a more assertive tone or cadence, you don't seem like you are being aggressive in the conversation. And you need to try to match them before attempting to deliver a message to them about the massage session. When you are communicating feelings or asking about theirs, you need to be very, very specific and define the words that you use. Do not assume that what you mean by a word is what your listener understands it to mean. For example, a massage therapist can tell a new client, "It's important for you to tell me if the method being used bothers you." Now, if you had just left it like that, the client might think, well, if it bothers me, that must mean it hurts or I absolutely can't stand it. But if it's just uncomfortable, that's okay, and they can keep doing it. You need to tell them bothers you, such as it might tickle you, it feels too deep, it feels too light, it feels ineffective, is it painful, or anything that makes you uncomfortable at all. That way, the word bothered is defined when you tell it to them. All right, so in a massage therapy office, effective communication is essential for professionalism and also to get proper informed consent. Make sure that the client is comfortable and that everything operates smoothly. So, what do we have in terms of client therapist communication? We have both verbal and nonverbal. Verbal is going to be anything that involves intake interviews. It's going to be consent discussions. It's going to be during the session while we're checking in on them and also getting some post-session feedback or the plan or scheduling another appointment. Nonverbal, of course, is going to include our body language, touch that we've already talked about in a previous lecture, and our facial expressions. Additionally, there's going to be administrative communication, which could be verbal or written. This is scheduling and reminders. Some of our policies we want to convey to them, like fees, packages, referrals, any type of missed appointment policies, sexual policies, informed consent, and forms that we get them to fill out, such as signing HIPAA forms and explaining waivers in our privacy policies. There's also interprofessional communication where you as a massage therapist are going to be communicating with other members of the client's healthcare team or writing referral notes or progress reports or SOAP notes, as well as submitting documentation for health insurance or if you've received something like a subpoena. There's also team communication. If you are in a company, can be staff meetings. It can be talking about relevant client information if one therapist is moving a client to a different therapist, or resolving conflict, which we're going to talk about later. Marketing and external communication is extremely important. When you're promoting your services on social media or putting up any educational content, you need to do critical research, all right? You need to have research literacy and critical thinking skills, all right? Make sure you are putting valid and accurate information out there, and make sure that the things that you are putting out there represent your image or brand appropriately, so that you are not doing your business a disservice by putting unprofessional communication out there. Client newsletters or community outreach all needs to be professional to uphold the standard of your business. There's also emergency communication. This is not just getting your client's emergency contact, but this is having a clear protocol for addressing client discomfort if they have a health crisis, especially if it's someone with severe allergies where there's a danger of anaphylactic shock and you might need to utilize an EpiPen, or someone with asthma where you may need to locate their inhaler quickly for them, and you need to report inappropriate client behavior or workplace hazards. You might need to communicate directly with first responders on an ambulance or a fire truck if an emergency happens at your work, or to be able to convey uncomfortable situations to your supervisor or to authorities. All right. Why does communication matter? Well, it builds trust with your clients. It ensures that you are being legal and ethically compliant. All right. You want to comply legally with things like HIPAA, informed consent, the way that you are behaving in the office so you don't lose your license and potentially get criminal charges. But you also want those clients coming back. It improves client outcomes. If they have better expectations, they understand what's going to happen. Informed consent was communicated clearly. They were educated on appropriate, reasonable outcomes for the massage, they're going to get a better session and be happier and more satisfied with the results and become a return client. And it also maintains professionalism. All right, you're going to have fewer misunderstandings in a group environment and fewer misunderstandings between you and your client. Right, the first step to communicating effectively is going to be listening. Effective listening involves the development of your focusing skills. You are going to pay attention to what your client is saying. You cannot listen effectively if you are distracted or planning what you're going to say next. If you are preparing your response, you are not paying attention to them. We listen to understand instead of respond. We clarify and show that we understood by paraphrasing what they have said back to them. All right. Understanding the message that they gave us and agreeing to it are two different things. A lot of times conflict arises because we think that understanding and agreeing are the same thing when they are not. Your client may be telling you, hey, I really, really want a deep tissue massage. I love trigger point therapy and I love deep compressive work. But they have been diagnosed with something like brittle bone disease, or perhaps they've got really advanced osteoporosis, something that's going to be a contraindication and potentially very dangerous for you to do deep compression on. You can tell them, hey, I fully understand that you want deep compression and deep tissue massage. And I understand that you would prefer that, and you've had that for most of your life, but now you've been diagnosed with this issue that is a contraindication. So while I understand what your request is, I cannot agree to it because it would not be ethical for me to give you this type of treatment with this diagnosis from your doctor. Now, there are different types of listening skills. Active listening is fully focusing on the speaker and acknowledging their words and responding thoughtfully to it. All right. So an example in the massage office would be nodding and maintaining eye contact during intake conversations, paraphrasing, which we just discussed. Make sure that you are clarifying what they just said and asking follow-up questions. All right. This ensures that the clients feel that they have been heard and it builds rapport with them. Reflective listening means that you are mirroring the speaker's words or emotions to confirm understanding. So, in the massage office, your client may say something about their shoulder being in pain, and then you can say, "You mentioned your shoulder feels like it has a stabbing pain in it. Is that accurate?" Or, "I hear that you're worried about the tightness in your hamstrings." This prevents misunderstandings about pain or preferences that your client has expressed to you in the conversation. There is also critical listening, right? This is analyzing information to make clinical decisions. We're going to identify contraindications in the health history, like the example of someone with osteoporosis that wants deep tissue, all right? We're going to decode vague descriptions like my neck locks up, all right? That could mean a lot of things. That could mean muscle spasming. It could mean that their joint is slightly subluxated. What is going on in there? We need to critically listen to what they're stating and then clarify. This ensures that sessions are safe and effective. There's also therapeutic listening. This is listening with empathy to support emotional or physical hearing. Now, this is not about healing them emotionally because you are not a talk therapist, you are a touch therapist, but you can listen to them even if you can't give them advice. You can notice their tone of voice when they mention stress. You can validate their concerns by saying something like, "It sounds like this has been really frustrating for you." Avoid judgment when clients share personal health struggles, and this creates a safe place for clients to open up about sensitive issues, all right? You are a non-judgmental space. Remember, one of our main goals in massage therapy, above and beyond massaging the client, is creating that safe environment for them. All right, we also have nonverbal listening. So this is listening to their body language, their facial expressions, their tension cues, noticing a client flinching during palpation. They may not say anything, they just tense up or stop breathing or twist away from it a little bit. Observing clenched fists or shallow breathing as signs of discomfort. We talked about in the sexual misconduct lecture about how breathing quicker could, indicate some level of arousal. All right. Clients may not always verbalize their discomfort, so their body language is going to communicate that to you. There's also directive listening. This is listening to gather specific details needed for treatment. All right. So you would ask exactly where along your spine does it hurt? Have them point it out to you. On a scale of 1 to 10, how intense is this ache? So we have a numerical value to validate that pain level. All right. This provides clarity for targeted techniques in the massage session. We also have passive listening. This is being silently attentive, okay? This allows the client to vent without interruption during relaxation massage. I know I've brought up verbal diarrhea a lot of times when clients relax on the table, or if they're nervous with a first time massage, they will chatter, chatter, chatter away. Or you can sit quietly while a client processes emotions post session. If they've had a psychosomatic release or some tension has left the body and now there's just this outpouring of emotion, this is your time to sit passively and allow them to get that out, because there's not really any advice that you can give in these situations other than to hold space and be there for your client. You do not want to do this in an intake interview or during the session if the client is not talking very much, because you will need to communicate to make sure that you are on the same page with how your client is perceiving your touch, as discussed in the last lecture. Now, why does this matter? Some clients need silence to unwind or reflect. They don't want you to respond. They just want you to keep rubbing and listen. There's also appreciative listening. This is listening for enjoyment or positivity. All right, laughing at a client's lighthearted joke, celebrating progress. Like a client says that their mobility improved from the last session, congratulate them. This strengthens the client therapist relationship. Now, you are inevitably going to have some level of conflict. So, we're going to talk about conflict and conflict resolution. Conflict arises when one or more people view the current system as not working. That means at least one person in the situation is sufficiently dissatisfied with how things are going and is willing to own the conflict and speak up in the hope of being able to improve the situation. All right. This can happen because of varied perspectives on a situation, differing beliefs or values, differing objectives that need to be obtained, or goals or interests. Concern about the effect of the dispute on the relationship may change how conflict is done. Time concerns, expenses, stress, lack of closure about something, or uncertain compliance issues. We're going to dive into those a little bit deeper. So, when you are in conflict with someone, it stands to reason that you are going to have differences, but you usually have a lot of common ground. There are usually things like overlapping interests or points of agreement or interdependence, like if you're two coworkers working at the same facility. This common ground can serve as the starting point for the conflict resolution. So, when you are working on resolving a conflict with someone, try to start with the things that you have in common first. Conflict resolution might only align things sufficiently enough to allow each person to make progress towards their goals rather than staying stalled in an uncomfortable or stressful state of disagreement. All right. A lot of times people will think that they have to win in a conflict. This approach is all about power and control more than about resolution. Usually, we want to find a situation that makes things right for everybody rather than just winning the argument. So there are different types of conflicts. One of them are relationship conflicts, which are usually called personality conflicts. And these occur as a result of strong negative emotions, usually from a misperception or miscommunication of some type, or repetitive negative behaviors. All right. These often lead to unnecessary escalation in destructive conflict. You see this a lot in domestic situations, right? We are fighting with our partner at home, that type of thing, or siblings fighting. All right. Personality traits are generally classified as behaviors, attitudes, and actions individuals use in combination to function in society. All right, an example in the massage office would be two massage therapists who have worked together for 2 years. Now, a new therapist has been hired, and this third individual prefers to eat lunch alone and remain in the massage room during breaks. Conflict develops when the two original massage therapists begin to describe their new coworker as stuck up and a snob because they don't eat lunch with them. Maybe this new therapist does not like the sound of people chewing. Maybe this therapist likes to do yoga or does a medical treatment on their lunch break and wants to remain in the massage room to stretch out and have some quiet time to decompress between clients rather than having to do the emotional labor of talking to two additional people in between all of the clients they've already had to deal with for the day. All right. They may not be a snob, they just might have health issues and be really sensitive and prefer to have that time to relax. So now you are spreading disinformation and you are creating a conflict where there doesn't need to be one because of a misperception or a stereotype. Another type of conflict is data conflict. This occurs when people lack information necessary to make wise decisions. They're misinformed. They disagree on which data is relevant in a situation. They interpret the information differently, or they've collected data differently. You see this a lot with children arguing with parents, sometimes students not understanding an assignment, getting upset with an instructor. A lot of times these conflicts are completely unnecessary, because they're either caused by poor communication or one of the people just needs to learn the information to resolve the conflict. So, an example in massage therapy, this can occur because of a scheduling problem. Two clients arrive at the same time for their appointments, and when they check their appointment cards, one of the clients realizes they entered the appointment in their calendar on the wrong day. So we have one client who was correct, the other client in conflict. It was a self-inflicted error. They had the wrong information when they were reading the calendar because they had entered it in incorrectly. All right, interest conflicts. All right, these are caused by competition over perceived incompatible needs. Conflicts of interest result when one or more people believe that to satisfy their needs, the needs and interests of an opponent must be sacrificed. All right, this usually occurs during times of scarcity, when it's perceived that there's not enough to go around. We saw this during COVID with all the toilet paper hoarding. Um, in the massage realm, this can happen. Like this example, there are 4 massage therapists that have been working full time at the same franchise for a year. They've all had these full time schedules, but now business has been really slow for the past 3 months. So now these 4 full time therapists are all potentially having to work part time, and now they are competing with each other for these client slots. All right, value conflicts happen when we have differing sets of values, all right? Um, they happen when people attempt to force one set of values on the other, or they lay claim to exclusive value systems that do not allow for divergent paths. So, in the massage therapy realm, this might happen like in this example. A massage therapist strongly personally believes that most health conditions can be controlled without medication. All right, this practitioner has a new client who uses a variety of medications to manage their anxiety. The massage therapist is finding it difficult to refrain from telling the client that anxiety can be managed with lifestyle changes and that medication is not necessary. The conflict is based on differing belief systems. Um, whether you think that there is a factual basis for the massage therapist beliefs or the client's beliefs in this situation doesn't really matter. They are differing on it. It is not the therapist's job in any way, shape, or form to impose their belief system on their client. They also cannot diagnose, they also cannot recommend or prescribe for or against medication. So this entire scenario is going to go downhill very quickly for a variety of professional reasons. Just like there are different types of conflict, there are different ways to deal with conflict or not deal with it. We could just deny or withdraw. We're just not going to get involved in the conflict. This is when a person attempts to eliminate the conflict by denying that it even exists and refusing to acknowledge it. Now, sometimes that's not as bad as it sounds. All right, in this example, there is a receptionist in the spa where a massage therapist works, and they tend to schedule massage sessions for a massage therapist who they are personal friends with more than they schedule it for other massage therapists. However, the receptionist is moving to another city in a month and will be leaving the job. So the situation is going to resolve on its own without intervention. So in this case, you're withdrawing from the conflict. Is there any purpose to complain about this receptionist to the supervisor if they're leaving in 4 weeks anyway? It might be a tough 4 weeks if you really need the income. That might be a consideration if you have a valid reason for that complaint. But if you can handle it for the next month, it might be better just to ignore the conflict entirely. Don't complain to the supervisor. Don't stir up any trouble at the office. This receptionist is going away anyway. All right, so suppression or smoothing over. This isn't quite denial. We recognize that it's there, um, but we play it down and we kind of just deal with it. And we don't recognize the positive aspects of acknowledging and managing the conflict openly. So in this example, a client is chewing gum during the massage, And the massage therapist finds this behavior incredibly annoying. The massage therapist has mentioned that chewing gum can interfere with the client's ability to relax, but the client chews gum anyway. The massage therapist learns to ignore the behavior, but do you learn to ignore it though? Do you really? Or do you let it fester and build inside because it's annoying every time this client does it? This can go very different ways if you just address it openly. You don't have to say, the sound of the chewing makes me go into a murderous rage. You can say, hey, look, it is a severe choking hazard when you are in the supine position. That means on your spine. Tell the client laying on your back. They may not know what supine means, but it is a choking hazard, and we don't want you choking, so nothing is allowed in the mouth while you are receiving massage in this position. You could state, hey, you could accidentally drop it on the floor or in the face cradle, or it could interfere with your jaw position when you are prone or laying face down. You can list a variety of reasons. But if they counteract and say, hey, he's like, I understand the choking issue. However, I have an issue with my inner ear balance or equilibrium, and this allows me to reset the pressure in my eardrum every time I chew. It keeps me from grinding my teeth and allows me to reset the air pressure back there. So I need to keep doing it, not just to relax, but in order to actually reset and feel better so I'm not grinding my teeth during the massage. Then you can revisit. Do they have things like silicone mouth guards in that case? Sure. But now you know that there is a reason to live with something this annoying. If you just suppress something, it's going to continue to annoy you until you address it openly and either find a reason to allow the behavior to continue so that you have closure, or you make the behavior stop. Right, power or dominance is another way to try to end conflict. That is just by saying, hey, I'm your boss or I'm your teacher and this is how it's going to go. That might be inherent in their authority, not always the best way to deal with things, though. It could take the form of majority, such as in voting. Everyone makes a decision. The losers in this don't support the final decision in the same way that winners do. And a lot of times there could be a continuous unconscious renewal of this struggle because it was settled by the use of power rather than both sides feeling like an appropriate settlement was reached. All right. An example in massage therapy is a massage therapist has just begun to work for a chiropractor who employs 3 other therapists. The chiropractor mandates a dress code of blue scrubs with the company logo and white athletic shoes. All right. The new therapist does not want to wear the required uniform and complains to the massage supervisor, who simply says, wear the uniform with a good attitude or you will be let go. In this case, this is a company uniform. United States is a, free will employer employee situation. So they absolutely can fire you for not wearing the uniform. So now it is up to you. They have solved this conflict with power and dominance. You either do it or you go. There's also compromise or negotiation, all right? This bargaining causes both sides to sort of give a little on there. They might inflate their side a little bit, saying that instead of both needing 5, they both may say, I need 10 to make sure that when they compromise, they actually get what they initially needed to begin with. For an example, there is a fitness center where 2 massage therapists work and it's being remodeled. And for 1 month, the massage rooms will be unavailable. There are 2 rooms that can be used instead, but one is really small. All right, one massage therapist has rented space with the fitness center for 3 years and the other for 2 years. After a staff meeting, it is agreed that the massage therapist will rotate, with each taking a shift in the small room, even though the massage therapist with 3 years thinks that they should have the large room the entire time. Now, the massage therapist that has been there for 3 years thinks they should have it 100% of the time. The compromise was that they both get it half of the time. I would argue that to be completely fair, maybe the one for 3 years could have it 3/5 of the time, and the other massage therapist could have it 2 days out of 5. But I'm not the manager in that situation if we're going by seniority. So neither therapist is happy because neither one wants to use the small room, but the one that has seniority is super unhappy with the compromise because they feel that they should get it because they've been there longer. All right. There are different ways to resolve this than how it was resolved that might be more fair. But either way, when you compromise or negotiate, neither people win, usually. All right. Integration or collaboration. This approach suggests that all people involved in the conflict recognize the interest and ability of others and they come together. All right. In this example, the owner of an independent holistic health clinic that rents space to massage therapists who function as self employed sells the facility and business to an individual who wants to change the business model to an employee system. All right. The new owner would like to hire the massage therapists who are currently renting rooms within the business, but there is resistance. They don't want to be employees. The new owner schedules a day-long meeting to discuss the issues and identify workable solutions. If we had done that with the two therapists at the gym, we might have come with the 3 days for the one and the 2 days for the other as a compromise. All right. When you collaborate, you still usually end up compromising, but in a way that is more equitable for everybody involved and their needs are being met. So, the atmosphere a lot of times determines how the conflict is going to go and the type of conflict. When everyone is defensive, that reflects the type of atmosphere characteristic of competition, all right? We all have to fight for our win. A supportive climate reflects collaboration. Everybody is going to try to lead to mutual trust and getting their needs met and manage differences, which usually leads to a lot of growth and effective change. One thing to notate when you do have conflict is to make sure that you document, all right? You should always maintain a written document, the documentation of the resolution, the success of the conflict resolution, the outcome that ended up happening. You need to make sure that it is objective and it is agreed upon by those involved to maintain clarity, especially if it is ever looked at again in the future, especially if it escalates to some type of legal action, like if it is a conflict with a client. So, we've already said that most conflict arises from miscommunication of some way or another, and there are some barriers to being able to effectively communicate. So, what are these? One is time. I mean, it takes time. I know that you guys probably feel like these lectures are 4 hours long sometimes because it takes time to explain concepts. This is why writing is sometimes a more effective form of communication. You can think about what you're saying rather than just talking to someone. We take time to consider the words and reflect on what's being said in a written answer. All right. The person responding to the written message also has time to reread and reflect on the message. All right. Falling into old patterns, old conditioning limits effective communication. All right. We need to recognize when we're becoming defensive to a situation or to a person rather than actually listening. Maybe we start reacting to them. So we need to take a step back. Maybe we have issues with self esteem or confidence that can make us fall into past behavior problems. All right. So if you've gone through some amazing personal growth, fantastic. If you find yourself falling into old arguments, take a step back, take a break, take time to consider a proper response, and then revisit that conflict or communication. Avoidance. I mean, there are dozens of reasons to want to avoid addressing conflict until it's absolutely unavoidable. You may not want to be around people who display strong emotion because it makes you uncomfortable. You could feel triggered and fall back into old patterns yourself. All right. Other barriers can be language, culture, and communication styles. All right. To be able to communicate effectively, we need to be able to use some sort of common ground language. All right. Sometimes a literal interpreter is needed, like for ASL or a different verbal spoken language. Sometimes we're just using words differently, as in the example earlier of deep tissue versus deep tissue. Which one does your client mean versus what you are used to giving? All right, so in the massage therapy setting, we touched on nonverbal communication a little bit. Now we're going to dive into it a little bit deeper because body language will communicate more than your words. All right, we said that in the beginning. We're going to try to hit home with some examples now. So, one thing is your facial expressions. All right, you're going to be giving them eye contact, but it's not going to be an aggressive stare into their soul. It's going to be soft eye contact to convey attentiveness and warmth. You're going to try to maintain a calm, neutral smile to try to reassure without seeming like too familiar with them. You can raise your eyebrows and nod. This signals active listening during intake. All right. Client cues, wincing and frowning. That could indicate pain or discomfort. Maybe they don't want to answer the questions you're asking in the intake. Closed eyes or a relaxed face shows trust or deep relaxation in some cases. Why does it matter? A therapist's expression sets the tone. A client's micro expressions reveal unspoken needs. All right, touch is so important that we have an entire lecture on it, but professional touch, you need to use confident, purposeful strokes. This communicates competence and confidence, honestly. Gentle pressure testing, check for client feedback, check for muscle tension, do that little feel, talk to the body, all right? That felt sense that we had talked about. Avoiding abrupt movements, all right? We don't want to jar them. We want to maintain a sense of safety, right? Client responses, if they flatten into the table, if they sort of relax or melt into it, that could signal that they're finally relaxing. Tensing their muscles might be anxiety or discomfort. Why it matters: touch is the primary therapeutic tool. Its quality directly impacts client trust and outcomes. Body posture, body language. In general, having an open posture, all right, uncrossed arms, that projects approachability. We don't want to cross our arms. We want to lean slightly forward. We want to show that we're engaged and interested in our client. Kneeling versus standing. Okay, so or sitting in a chair next to them. You always want to meet your client at eye level. All right, you don't want to loom over the client. If I'm talking to the client for a prolonged period for whatever reason, if they're on the table already, I will sit down to speak to them instead of bending over. Or I will do my little Slavic squat and I will sit low on the floor to talk them eye to eye. All right. Client signals with body language and posture. If they are curled up in the fetal position, this may indicate emotional vulnerability. All right. Stiffness or shallow breathing. This suggests unresolved tension of some sort. They're probably feeling pretty anxious. Body language reveals comfort levels and guides adjustments in real time during the massage. All right, proxemics. What is proxemics? This is our personal space. All right, we're always talking about distal and proximal with the body, right? Distal is more distant from the body. Proximal is closer to the trunk of the body. So, how close are we to their trunk of their body, their personal space? Our proxemics. You need to respect the table bubble as a therapist. You need to avoid hovering unnecessarily or being so close to them. If they are having an emotional release, give them space. All right. If a client starts shrinking away from you, they may need more space or they might actually need you to work at a slower pace in the massage. Why does this matter? Respecting spatial boundaries fosters a sense of safety. Paralanguage, all right? Tone, pace, and silence, all right? Sometimes not talking is a form of communication. Use a slow, quiet tone to promote relaxation. Minimal speaking avoids overstimulation during sessions, especially if your client is not being over talkative. If the client has hesitant speech, that might signal embarrassment or uncertainty in what they're asking for. Sighs or moans indicate release. Context matters. Make sure professionalism is being upheld, and this is a moan of the good pain and not sexual. Why it matters, vocal subtlety, all right, how subtle we are in our changes in our vocal tone, in our volume, in our pace, can make or break the therapeutic atmosphere. Now, we touched on eye contact earlier, but this is directly about eye contact or lack thereof. Some clients might avoid eye contact out of respect or out of discomfort. All right, we'll throw back to our neurodivergence here. Sometimes there'll be intense staring because how long should I look at them in the face for it to be correct? Or they're staring at your eyebrows and they're just steady staring at your eyebrows, but you think it's your eyes and they're just staring into your soul, even though they're not even looking at your eyes. Sometimes it can get weird with eye contact. Mirror your client's preference without being weird, please. Some eye contact is normal. All eye contact is not. No eye contact is not. All right. Brief eye contact during consent discussions to ensure understanding. We're like, do we feel each other right now? All right. Avoiding prolonged stares prevents perceived intensity. All right. Why it matters, misreading eye contact can alienate clients from diverse backgrounds, or just from a safety standpoint. Gestures. Therapist cues hand gestures to explain techniques like mimicking stretching motions. As an example, palms up or open hands suggest transparency and caring. A client's gesture pointing to pain areas is really important. This is the nonverbal way to direct focus on exactly where their problem areas are. Very beneficial during the intake. Why it matters, clear gestures reduce reliance on verbal interruption. Right, timing and rhythm. The therapist's pace during the actual massage itself. Slow and rhythmic movements induces relaxation. Pausing after pressure adjustments allow the client's processing time. Matching breath with strokes for the client deepens the mind-body connection, okay? Why this matters, pacing aligns with the nervous system's response to touch. This is very important. We want to elicit a parasympathetic nervous system response. So we want to align our pacing with their response to our touch, all right? Key takeaways for you guys. Non-verbal communication is more important than words. Clients often remember how you made them feel much more than what you said, unless you said something egregious. Cultural sensitivity. Interpret cues cautiously. Silence may signify peace or dissatisfaction. Self-awareness, monitor your own nonverbal habits. Tense shoulders may transfer that you're feeling stressed. If you've got trouble with eye contact, work on that for confidence. Red flag alerts, a client's crossed arms, stiff posture, lack of response, all might signal discomfort, so check in with them verbally. So, some important strategies maybe to address or repair nonverbal missteps in the massage session to ensure client comfort and maintain your professionalism is, let's deal with some accidental overpressure or pain you may have caused that client. So, a nonverbal cue from the client would be like flinching or their muscles tensing or like they like gasp in. It's a sharp inhale or they grimace. How to repair this? Immediately lighten the touch and pause. Verbally check in. Ooh, I noticed a reaction. Was that too much pressure? Adjust the technique. Switch to broader strokes. Reduce the depth. Apologize if needed. I appreciate you letting me know. I apologize. That was uncomfortable. I'll adjust. Use the client's breath as a gauge. If they hold their breath, the pressure may be too intense. What if you misread somebody's boundaries? Again, we're talking about proxemics. A nonverbal cue from the client could be shrinking away, they're stiffening or covering exposed areas, like they are pulling that drape in tighter. All right, how to repair it: step back slightly to give physical space. Reconfirm consent. Is this area still okay to work on? Adjust the draping. Let me know if you'd like more coverage here. And if the client seems guarded, avoid leaning over their head and face because it could feel incredibly intrusive. All right, unintentional emotional triggers. What have you done? All right, you have released something within this client. They may have sudden tears, a clenched jaw, or emotional withdrawal. You need to pause and lower your hands and give them space to process. Give them neutral validation. Let them know it's okay to feel whatever comes up. Take your time. They may not know what's going on if it's a psychosomatic release. Offer them options. Ask them if they'd like to continue, if they'd like to switch focus in the massage. Would they like to take a break? A pro tip is to keep tissues within reach at all times. Also, have a plastic lined trash can, throw them away in, and avoid over comforting, like hugging the client, which can blur professional lines. All right. What if you have misaligned your pace or rhythm during the massage? All right. The client is just not enjoying your speed. The nonverbal cue is going to be something like fidgeting, sighing impatiently, or seeming checked out. You can repair this by mirroring your strokes to their breath. So you're going to sync your strokes to their exhales to reestablish the connection and ask, hey, would you prefer a faster or slower pace? And observe their feedback. If they relax into the slower strokes, stick with it. Clients under stress may prefer brisk, structured touch, and those seeking relaxation need slower, fluid movements. All right. And under stress here is meaning under more physical stress than mental stress, which is in need of the slower, fluid movements. All right, awkward silence or over talking, that verbal diarrhea. The nonverbal cue from the client is avoiding conversation with you, short replies or strained silence. How to repair: match their energy. If they're quiet, minimize your chatter. Use music or white noise only in the background. Gauge their preference. Some clients want to zone out, others prefer light conversation. What's your style? Redirect the focus. Let me know if you'd like adjustments or have questions. If they are someone that's incredibly quiet, ask this a couple of times, but they may indicate by their silence that they don't want you asking a lot of questions. They're just there to enjoy what's happening. Pro tip: if you accidentally overshare while you are talking, you have slipped that professional boundary a little bit. Reset with silence and refocus on their session. Remember from our professionalism lecture, sometimes learning how to communicate properly also learning how to be quiet. Sometimes we make a cultural misstep and you might get a nonverbal cue from the client, like avoiding eye contact. They might seem hesitant. They might misinterpret your gestures. You can repair this by learning about your client, asking direct questions, doing a little bit of research. Maybe in their culture, direct eye contact is rude. Clarify: I want to respect your preferences. Let me know if anything feels off. Adapt touch. Some clients prefer same gender therapists or they don't want things like joint mobilization. Use universal nonverbal cues to the best of your ability, like open palms or slower movement to bridge gaps. Please remember that your clients may misinterpret those as well. Being accidentally overfamiliar. All right. If they pull away from casual touch, like squeezing their shoulder. Again, I know that a lot of places think that this is okay, but if you don't know your client that well, don't just grab them when they're not on the table. This can lead to all sorts of misinterpretation and issues. They might seem uncomfortable with humor. They don't like what you're joking about. You can repair this by reverting to a more clinical tone and focusing on technical language, stating, hey, your trapezius feels really tight, instead of saying, oh, you're so full of knots or you're knotted up. Avoid personal comments. Stick to the situation, the massage at hand. Discuss the music that is being played, their preference for the music during the massage, not if they like to go to concerts or not, or the temperature in the room and how they feel. Reset the boundary by letting them know that your goal is their comfort, so please don't hesitate to speak up. If a client mistakes professionalism for friendliness, politely steer the conversations back to the treatment being done at the time. Just like in conflicts, if a misstep occurs, which could lead to a client complaint, briefly note it in their file. Like client reported discomfort at 20-minute mark, pressure adjusted per feedback, so that it is notated in the record. It's in your SOAP note. In case this client complains about what happened, you can say, hey, yep, I know that this occurred. I notated it. We discussed with the client. We readjusted to their satisfaction at that time, so that you can come back with a response that is appropriate with that complaint. Use it as a learning tool for future sessions. Now, key takeaways here: nonverbal missteps happen. What matters is how you repair them and when, which is immediately, if at all possible. You need to prioritize client agency. What is that term? Autonomy, all right? Client agency, client autonomy, right? They are in control of the session at all times. Reflect post session. What cues did you miss from that client? How can you adjust next time? And the best therapists aren't always perfect, but they are very responsive to their clients and their clients' needs.